And a number of my patients, like other people's patients, were ex-boarders. And we used to go past this and not take a great deal of attention to it. You know, people went to a grammar school, they went to a boarding school. And sometimes those who've been to boarding school have got tremendous panache when they come in. You know, they've got a great polish. They've come because they're depressed, but you'd never know it, because they're really good at hiding their suffering. And it was in about 1990, I had a man came to me for depression. And in the first 2 weeks of the therapy, he immediately engaged and poured out the trauma of going to boarding school when he was 8. He was the son in a family of daughters, and he had been groomed for this. It was a great privilege. He was the only one going to boarding school. So when he arrived, the shock and horror of actually that he was being left there was enormous. And it had haunted the rest of his life, the things that happened to him there, and the loss of his family. And that was the thing that really got me interested. So then I realized, started thinking about it, listening to my patients and to my colleagues' patients when they talked in peer supervision. And we discussed patients, and often in passing, someone would say, well, he went to boarding school, or she went to boarding school. And that was it. Nobody took any notice beyond that. The fact that they were really lonely or disturbed was never attributed to the fact that they'd had been traumatized as children. So in my book, I decided to analyze exactly what this is made up of. And we needed a name for this because we need to be able to identify that this is not just an individual person. What I find with ex-boarders now, when they write to me, is the relief to know that they weren't the only one. Because most people who suffered at school are ashamed. They're ashamed because they should have done well. And, you know, everybody does well. They see everyone around them, you know, thriving, and they're not. And they think they're the only one until they meet other people who also suffered in the same way. I came to realize this was really important, that we as therapists needed to be able to talk about it, but actually as a society we also need to be able to talk about the suffering inflicted on children going away from their home when they're very, very young. So going away from home when they're really young is a traumatic event. They lose everything that's familiar. They lose their home, their parents, their toys, their siblings, their bed, the food that's familiar. The child loses everything. And so when I'd finished my book, I came up with this term, boarding school syndrome. I didn't really quite know where it came from, but there's a lot of us discussing things around, and it just seemed to be the right thing. And I kind of thought, I can't call it this. I wrote an article in 2011 when it's the first time I used it. And I thought, I can't actually call it a syndrome. And then I thought it is, because a syndrome is a pattern of ways of relating. It isn't necessarily about disease. It's a pattern of ways of being that can be identified. And this was very common with ex-boarders, that you could identify problems with intimacy, difficulty in relationships as adults, having very often in their 20s, having a great time, going off and, you know, escaping the prison of boarding school. And then when the children get to the age they were sent away, so 6, 7, 8, quite common. And girls often have gone later, but not always. And they notice how very young their children are at that age. And then they start to feel, not really knowing what it is that's hitting them, depressed or upset or very angry. And so we identify this over time. So what I've come up with, I've been working in this field for a very long time now. And when I wrote the book, I wanted to analyse this, what I call the anatomy of the trauma. But actually, it's multiple traumas.